So what brings me hope now and is that for the first time ever, I think schools with resources can actively address mental health needs, and especially in tribal communities. They've done it all along, but I think it can be more systematic now. And I believe one thing that gives me hope is that the integration of mental health into our education system needs to be there. When you see what is wrong with the education system, you often see that children have been not identified for having psychological disturbances, and then they go out and do something very elaborate like school shootings. And so now comes the opportunity to rebuild the schools and to recognize the schools for what they do. And they never, tribal schools and other schools never get enough recognition. The teachers never, they're the lowest paid professionals, and the teachers don't get the recognition that, there are times when my daughter's a teacher on the Standing Rock Reservation. There are times when she's digging in her own pocket to buy Christmas presents. There are times when she's staying and calling me and saying, Mom, there's something going on with the students, and I give her guidance. The schools need to integrate mental health on a daily basis. And can be delivered in many, many ways, cultural ways. Our cultural ways are resilient and they're resourceful for addressing mental health. The songs and the language and the movement is a way for children to engage in positive mental health. And the schools do that, but they don't get recognized for it. And now comes the time to strengthen the schools in mental health, everyday mental health, integrating it into the classroom system, integrating it into all that we do to strengthen it. But again, we need resources. We need financial resources. We need um, cultural resources. We need access to equitable resources.